Welcome to this explainer. Today, we're going to break down the latest clinical guidelines and research to empower you against a truly silent health threat. Look, if you're focused on optimizing your health, understanding the hidden mechanics of your metabolism is absolutely essential. Today, we aren't just looking at the problem, we're looking at the evidence-based solutions. Okay, let's jump right in with the big one. It's the absolute most important question on everyone's mind when they hear the word prediabetes, right? Because when you hear that prefix pre, it kind of sounds like the ink is already dry on a life sentence, like a train that's already left the station and you're just along for the ride. But as you'll see, the scientific literature tells a completely different and honestly incredibly hopeful story about what's actually possible here. But first, to really understand the stakes of this conversation, we need to look at the data from the CDC. Currently, more than 1 in 3 American adults has prediabetes. 1 in 3. But here is the number that should legitimately make you pause. An unbelievable 80% of them don't even know they have it. Because this condition operates basically in the shadows, without clear symptoms, we're talking about millions of people living in a high-risk state, completely unaware. Section 1. The silent prediabetes threat. Let's see how this hidden condition actually builds up in the body. So, by definition, prediabetes is a condition where your blood sugar levels are running consistently higher than normal, but, and this is key, they haven't crossed that final threshold to be officially diagnosed as type 2 diabetes. Think of prediabetes not as a final destination, but more like a critical warning zone, telling you it's time to take action. It's basically your body's check engine light turning on. Moving on to Section 2, making the official diagnosis. Now, doctors don't just guess where you are on this blood sugar spectrum. Relying on strict clinical practice guidelines from organizations like Medical Associates, they use 2 simple standard blood tests to figure out exactly where you stand. These tests give a crystal clear snapshot of your metabolic health, and the best part is they're readily available at literally any primary care physician's office. Looking at these exact action thresholds, the first one is your A1C, which measures your average blood sugar over a 2 to 3 month period. If your A1C is between 5.7 and 6.4%, or if your fasting glucose, which measures your blood sugar after not eating for 8 to 12 hours, is between 100 and 125, well, you're right in that prediabetes warning zone. These are the absolute critical numbers you want to know and track. Section 3. Decoding your risk factors. So, how do you end up in this warning zone to begin with? Well, it's kind of like a card game. It's a combination of the cards you're dealt and how you decide to play them. The American Heart Association strictly divides risk factors into 2 buckets. On one side, you have what you simply cannot change, your non-modifiable risks, like your age, your family's medical history, and your genetic background. But on the flip side, you have your modifiable factors. These are the things you have absolute control over, like your daily physical activity, your blood pressure management, and your weight. And honestly, this is exactly where your power lies. But, your age at diagnosis completely changes your risk profile. There was this fascinating massive study out of the University of Leicester that tracked hundreds of thousands of patients. And they found that men diagnosed with prediabetes before age 55 were actually twice as likely to progress to type 2 diabetes or cancer within 10 years compared to men diagnosed at 75 or older. So the big takeaway here is the younger you are when you enter this warning zone, the more aggressive you need to be, because those long-term compounding effects are severe. We also have to look at unexpected risk factors, like PCOS. Now, this is a really common hormone disorder that causes intense insulin resistance, meaning your body makes insulin but just can't use it effectively. Because of this, the CDC notes that over half of women with PCOS will develop type 2 diabetes by the time they reach age 40. That is huge. It dramatically accelerates the path, making early screening absolutely vital. Section 4. The sleep-insulin connection. Let's dive into another highly surprising hidden villain here. And this one has absolutely nothing to do with what you eat. We're talking about a lack of sleep. Getting less than 7 hours of sleep physically alters your body at a cellular level. An NIH-reviewed study shows that partial sleep deprivation causes a massive spike in inflammatory markers, things like CRP and SAA. And this inflammation, it creates circadian misalignment and directly increases peripheral insulin resistance. So you could have a perfect diet, but if you're routinely starving yourself of sleep, you're actively pushing your body toward prediabetes. Crazy, right? Section 5. Reversing the trend. Okay, here is the absolute most empowering part of this entire explainer. You can fight back. Remember those modifiable risk factors we talked about a minute ago? Well, this is where we put them into action. As Dr. Matthew Lash from Franciscan Health points out so clearly, prediabetes is highly reversible. He notes that lifestyle changes are actually far more durable and effective long-term than just sitting back and waiting for an eventual prescription. The vast majority of people can return to a completely normal metabolic range. So how do we do it? These 4 simple, targeted steps create the ultimate toolkit to blunt those blood sugar spikes and completely halt the progression of the disease. You want to aim for 150 minutes of moderate exercise a week and balance your plate so half of it is non-starchy vegetables. But perhaps the easiest, most effective daily habit? Taking a brisk 10-minute walk right after your largest meals. It's literally like flipping a switch to use up the glucose circulating in your blood immediately. And the payoff for these habits is just immense. By executing just the first step from that list, losing 7 to 10% of your body weight, you can reduce your risk of progressing to diabetes by an incredible 54%. Let me put that into perspective for you. If you weigh 200 pounds, actually, scratch that. Just doing the math, that's losing just 14 to 20 pounds to cut your risk by more than half. That is an absolutely massive return on your investment. Prediabetes thrives in the dark. It relies on us not checking our numbers and not recognizing the silent warning signs. But now that you know exactly how it works, and more importantly, exactly how to reverse it, the power is entirely in your hands. So what small change, whether it's grabbing an extra hour of sleep, taking a 10-minute walk after dinner, or just calling to schedule that A1C test, what are you going to do today to rewrite your body's future?